Hey everyone, Dr. Patrick Malarczyk here, chiropractor, sports rehab specialist, and someone who's passionate about helping people get out of pain and back to doing the things they love. Today, I want to take you behind the scenes into a real case from my clinic. These are the kind of things I see every single week, and if you're dealing with neck pain, arm tingling, or weakness, this might hit close to home. So let me tell you about one of my patients. She's a 38-year-old woman who came in with neck pain and numbness radiating down her left arm. She said it was affecting her work, her sleep, even just driving or scrolling on her phone. It was constant, nagging, and worse in the morning. Now, during the exam, all of her neurological tests were normal, which is great, but she did have some numbness and tingling down her arm, and there were a few orthopedic tests that suggested possible nerve root irritation on the left side. Her range of motion was clearly limited, especially looking up, turning to the left, and looking down. She felt a ton of pulling with that last one. After taking everything into account, her history, the exam findings, and how her symptoms behaved, I diagnosed her with a cervical disc derangement. That basically means there's something likely disc-related irritation or dysfunction in her neck that's pressing on or irritating the nerve root. So here's how I explained it to her and how I approach cases just like this one. On day one, we always look for three key things. Number one, is range of motion improving? Number two, is the pain intensity decreasing? And number three, is the pain location changing? What we call centralization. This last one is huge. We want to move pain that's way out of the hand or forearm and closer to the spine. That's a great sign of the nerve and the body healing. So that first visit, we kept it pretty simple. We started with some passive care, a little electrical stimulation and heat to get the blood flowing and to relax the area. Then I adjusted her mid and upper thoracic spine, getting some extension back into the joints, which often takes pressure off of the neck. I did some manual therapy to create a little traction in the neck, open things up a bit. Then we got into the good stuff, the McKenzie Method, or what's technically called mechanical diagnosis and therapy. This is where things start to get very personalized. We're trying to figure out her directional preference. Which movement improves her symptoms? So we tried some different movements, and what worked best was seated chin retractions. These started pulling the pain out of her hand and forearm and into the triceps. That's centralizing pain. Boom, direction found. I sent her home with a simple plan. 10 repetitions of chin retractions every couple of hours. That's it. When she came back for her second visit, her range of motion was a little better, pain was less intense, and the pain was centralizing, especially in the mornings. She was also sleeping a bit better. So we progressed the exercise. This time we added seated cervical retractions with extensions. This took the pain even further up from her triceps to her upper traps and shoulder blades. Again, that's what we want, centralization. I told her, this is your new movement, stick with it. By the fourth visit, her arm pain was completely gone. No more tingling, range of motion was nearly restored. At that point, we scaled back the passive stuff and shifted to active therapy. I added some scapular stability exercises using a resistance band. Basic, but important. We continued her home exercise routine, reinforcing the same directional preference. By visit 7, she had no more arm symptoms, just a mild ache in the lower left side of her neck, about a 1 out of 10. Honestly, that's a huge win. Now, I see this case all the time, but unfortunately not every provider approaches it this way. Too many places use a cookie cutter approach, the same exercises, same treatments for everyone. They're not testing and retesting. They're not looking for directional preference. And that's the key to solving these cases so quickly. If you don't know what direction improves your pain, you're just guessing. But when you find the right direction, when you see centralization, that's gold. That's your green light. And it's not just about reducing pain, it's about restoring function, getting people back to living their lives pain-free. Now, of course, this video is for educational purposes only. Always consult with a qualified healthcare provider to get a proper diagnosis and personalized treatment plan. If you found this helpful and you want to hear more real patient stories, clinical insights, and practical solutions for pain and movement, don't forget to subscribe to this channel. Thanks for watching, and I'll see you in the next one.